If you had to choose to fall into the arms of someone in a crowd, wouldn't you rather fall into the familiar arms of a friend? That's how antibodies work against antigens immobilized on a solid surface. In fact, antibodies can only bind antigens that they recognize as familiar. Now, this familiarity and exclusive match is the basis for many of our innovations in biomedical research. For my research in particular, the specific recognition between antibodies and antigens can be manipulated into developing a point-of-care rapid test, pretty much like a pregnancy test, but to diagnose infectious diseases using a single drop of blood. Now, in most cases, antibodies recognize antigens better than you would recognize the face of a loved one in a room full of strangers. But oftentimes as well, antibodies may recognize weakly a similar but different group of antigens, much like you might mistake the brother of someone you met recently at a party. Now, this is a common challenge in developing many diagnostic tests for many diseases, but it's particularly true for TB, a severe, life-threatening lung disease that afflicted 8 million people in 2012. To address this challenge, my PhD focuses on a group of antibodies called dimeric IgA. Dimeric IgA is the main antibody produced in a mucosal infection, infections that occur in moist tissue lining the insides of our bodies, such as in the gut, liver, and the lungs. Unlike other antibodies, dimeric IgA is produced early and it's produced at the site of infection, so we believe it's more specific towards antigens. Now, this has been shown to be true when I looked at diseases infecting the liver, viral diseases infecting the liver. So further to this, my aim is to determine whether dimeric IgA recognizing TB antigens can eventually be used to make accurate point-of-care diagnostic tests. Cheap, simple tests that can be used to diagnose TB quickly, whether in busy hospitals in big cities or in quiet health posts in remote villages. Such a discovery could mean the difference between treatment and cure of someone with TB or their infectiousness and death. Such a discovery would be an antibody-antigen match made in heaven. Sorry for that.